Hi, good evening, everyone. Thank you very much, Africa and the world. I want to specially welcome you to yet another wonderful edition of your $1 billion Body Show. And again, my name is Marvel. Thank you very much for coming on the show today. And as usual, I'm not alone. I have our very own in house salad master doctor in person of the wonderful Dr. Dolly. Hi, Dr. Dolly. Good evening. How are you today?
I'm great, Marvel, and you?
Very fine, very fine. You look amazing today.
Thank
Yeah,
you.
that's because you're on the 30-day challenge, I believe.
Oh yeah, oh yeah. One thing I've actually noticed that my skin actually gleams during
Wow,
this time. I've
fantastic.
not seen that before.
Fantastic, absolutely. Now, we had such an exceptional time yesterday, and if you were on the show, I believe you would agree. Please, it's time to invite everybody who you're expecting to be on the show. Send them a message, send them a link. You can actually click like and also subscribe on the channel that you're watching from right now if you're on YouTube. And we're streaming live on Facebook as well. So you can also create a watch party. Yesterday, we started talking about some very beautiful things in terms of health and nutrition. Beautiful topics that would interest you. I know you probably followed yesterday. So we're going to be continuing today. And we looked at cancer and also infertility. But today we'll be we'll be delving deep into them. And if you do have your questions, you can put it in the comment section and also in the chat area. And our amiable Dr. Dolly is here to take all your questions. So without wasting any time, I want to especially thank Salad Master for sponsoring the show. And Salad Master is that health and nutrition company that ensures that the food stays healthy. So thank you, Salad Master, for bringing us health and nutrition to our screens. I'm going to go now to Dr. Dolly. Dr. Dolly, what do you have for us today? And I'll just say over to you now.
Okay. Welcome again, like you said before, to your $1 billion body. I am Dr. Dolly, and today we'll be looking at a whole gamut of things, namely prostate cancer, breast cancer, and ovarian cancer. To now crown it all, we'll end with infertility talks today. Now, I know we've dealt with prostate cancer before on this show, so it can also benefit you to also look that up. But today, before we talk about prostate cancer, you first of all need to appreciate what a prostate is. What is a prostate? A prostate is said to be a small walnut-sized gland that produces seminal fluid in the male reproductive system. And what is seminal fluid? Seminal fluid is that fluid that nourishes and also transports the sperm. That's what it is. Now, when you start having problems, we'll go in detail to the symptoms you need to have before you know that prostate cancer is creeping up on you. Now, this occurs in men above 40 years. So if you are below 40, you really have nothing to worry about. But then we talk about prevention all the time. It will do you good to also prevent it so that when you are above 40, you don't have anything like prostate cancer to worry about. Now, what are the symptoms? First off, difficulty in urination, like I mentioned yesterday. Another one is that it can be asymptomatic, meaning that you might not have any symptom, but it is there. Another one is painful or burning sensation during micturition. Micturition is also urination. When you want to pee, it becomes something else. It's painful or it's burning. It's not supposed to be like that. That's not the way nature meant it to be. So if you have anything like this, is a pointer that something is wrong. So you need to get checked out. Another one, yet again, is a difficulty stopping or starting urination. You have started it, but you can't stop. It keeps dripping. That's a problem. Or you go to the loo, you want to void, but it's not coming. It just comes on its own. That's a loss of control because there's a mechanical obstruction to the urine. That's why it's happening that way. Another one is also sudden erectile dysfunction. But when we mean erectile dysfunction, most people don't know what it is. So let me shed a little light on that. It means inability to attain and maintain an erection sufficient for intercourse. When you have a problem like that, it might just be pointing to prostate. Another one that nobody sees this one and stays at home is if you see urine, a blood in your urine or blood in your semen, just run. This is a very late indicator for prostate cancer. Like I mentioned yesterday, not every growth in your prostate gland is cancerous. You have what we call the benign growth, which we call BPH. BPH simply means benign prostate hypertrophy, and it is just age-related prostate gland enlargements that can cause urination difficulty. So this one is non-cancerous. You can if it's not causing any urination disturbances, you can actually live with it, no problems. Now, what causes this prostate cancer? Like I said before, changes in your DNA, mutations in genes that suppress tumors, like BRCA1 and BRCA2. If they are mutated in you, we're not praying for that, but if they are, that person might likely come up with prostate cancer. Now, these genes are located in the DNA. Like I said yesterday, DNA are just contained cells, and they give the cell instructions on what to do. So now, if your DNA contains mutation on this gene suppressors or tumor suppressors, your DNA just telling your body just grow tumors, no problem, just grow, and it will keep growing tumors after tumors. Now, prostate cancer kills like 30,000 men every year. So we don't want anybody who's watching this show to be among them. If you've already got it, early detection helps on the mortality rates. Now, let's get to the food part, the part that Salad Master masters on, actually. Foods that help you fight prostate. Like I said yesterday, you have your cruciferous vegetables like broccoli, cauliflower, spinach, kale, Brussels, cabbage. They help a lot with that. Another one, surprisingly, is water. Water is everywhere. Water is life. Drink lots and lots of water. It helps with that. Another one also that they have also researched on is coffee. 4 to 5 cups of coffee every day also helps in fighting prostate. Also, it has been researched that low carb diets and high fat diet slows prostate. And some exercises can help as well. We have what we call the Kegel exercises. These are good for controlling incontinence when you have the symptoms. So Kegel exercises are advised in this case. So that's just it for prostates.
Wow, amazing. Yeah. Now, I learned a lot from what you said, Dr. Dolly, and I know
Okay.
our viewers right now are currently learning a lot on prostate cancer.
Mhm.
Right now, one question I want to ask, Dr. Dolly, because I
Okay.
probably didn't hear you mention it. Probably it's something that you want to talk about.
Okay.
Is prostate cancer actually hereditary?
Yeah. Um, actually, actually, I talked about it. Anything, whenever you hear DNA gene, is actually goes from transferred in bloodlines. So when I mean gene, your gene is mutated. You can actually inherit a mutated gene from either parents, or you can be born with the gene and you undergo that particular gene undergoes the mutation and it occurs. So it's actually inherited.
Oh, so prostate is actually could be inherited.
It could be inherited, but a low percentage.
Okay.
Yeah.
Okay. Wow, that's amazing.
Yes, it is.
Okay.
So we move straight to breast cancer. Now, breast cancer is huge, it's broad, it's many. We have many types of breast cancers. We have the breast cancers that starts with the ducts. You know, how will I explain this? The breast organ is actually an organ, especially in women, and it's just for you to understand, it's just a packet in which you store so many straws. Those straws are channels or glands or ducts, actually. They are called ducts, mammary ducts. That's milk passes from the breast gland and breast and parenchyma to the nipple. And now at the nipple, the straws just converge there together. So breast cancer can come from the soft tissues in the breast gland. It can come from the fat mass of it. It can come from the duct, and it can come from the skin on the breast. So these are various types of breast cancers you can have. And how does it present? How do you know something is wrong? For females, particularly, you have new lump in the breasts, a lump that hasn't been there, but all of a sudden you touch and it is there, either in the breast or under the arm, on your armpits. Is a stuff to worry about. Now, swelling in any part of the breast. Now, this is not a lump now, this is a swelling. Any swelling, it needs to be checked out. When you have irritation or dimpling of the skin on the breast, some people have dimples on their cheeks. Normal, it's okay. It
I
has
got one.
you got oh my god. So now when that dimple, you now notice it in any part of your breast. I mean, that's not a thing of beauty. On the face is accepted, is a sign of beauty. It shows you're beautiful, but on the breast is a worrying
I will
sign.
go scared when you said people who've got dimples.
No, not on your cheeks.
Okay.
Not on your cheeks,
Right.
definitely not. But on the breast is something to worry about. Now, if there's redness or flakiness of the nipple area, it's not swelling. When a skin is so dry, it can be swelling. Now, nipples that discharge any other fluid than breast fluid. That's a problem. Ovarian cancer will predisposes you to both breast cancer and ovarian cancer. Another one is also increase in age. We all pray for long life, but with long life comes so much health challenges. This is one of them. Another one is if you've had a personal history of breast conditions in the past, anything that's happened in the breast, whether you used to have a lump, now cleared, whether you had discharges and now it's okay. If you did have it when you were younger, as you're hitting 40, you should be on the lookout. Also, family history. Does your mom have it? Does your auntie have it? Your sister, cousins, distant and close ones, do they have it? If you have a family history of breast cancer, you might likely be a candidate. Another one is inherited genes that increase breast cancer. Like we said yesterday, genes, you inherited it from mom or dad. They can be transferred from generation to generation. Can also be a cause of breast cancer. Another one is radiation exposure. If you've been exposed to radiation at any point, especially when you were younger, it also predisposes one to that. But I think for the radiation exposure, they have lead coverings or lead shields that people wear to minimize that risk. Last but not the least on my list is obesity. When you're on the far high side, this is one of the very damning complications of obesity. So if you're on the big side, you need to get screened as often as possible. Now, what are the foods that are indicted? The foods that research has shown that people who eat more of this food come down more with breast cancer. We're not saying by any means that this kind of food cause it, but there is a correlation between people who consume more of this food and incidences of breast cancer. Number one is alcohol, binge drinking it. Moderate consumption of alcohol, I don't think does anybody any harm. It's only when you abuse it. Another one is the added sugar. Added sugar is one of the foods indicted in breast cancer. Another one is fatty foods, beets, fatty meats, all of that. They cause it. Another one is red meats. So this is even a Lenten period for the Catholics. So this might be a good time to turn your attention to fish. And then, like we've always said, processed foods, they contain a whole lot of fillers, a whole lot of artificial things, a whole lot of enhancers. And those ones, most of them, are cancerous or carcinogenic organisms. Now, avoid if we can. And then what options does this leave you open to? What food do you eat? Now, according to a recent study that was done on 75,925 women, it says that women who they've had a whole lot of peaches, apples, and pears that they happen to be the women who have the lowest occurrences of breast cancer. So, peaches, apples, and pears, they are actually cancer protective. So, it is advised. Fruits in general are anti-cancerous, and these ones in particular should be paid attention to. So, that's what I'm going to take on breast cancer today. But before I leave the topic completely, I need to let you know how you can prevent breast cancer and ovarian cancer. They are
Okay.
intertwined.
Amazing, amazing. Again, now just before you actually go to prevention,
Okay.
okay? Now, this very important question, probably someone watching right now might want to ask. A woman or a lady
Okay.
or a young girl watching. And I know yesterday, particularly, you said something about male breast cancer
Mm-hmm.
or breast cancer in men.
Yeah.
That's probably the first time some people probably would have heard that men are probably susceptible to having breast
Breast
cancer.
cancers.
Now, the question here is, at what age, as a lady,
Yeah.
should you probably be concerned? At what age should you be concerned about having a check or something? Without noticing a lump, at what age should you be watching out for it? Something like that.
From 50 and above.
50 and above.
Yes.
50 and above. Fantastic.
Yes.
Now, the follow-up question to that is, can someone have a breast cancer and not know? Is it possible?
Can someone have a breast cancer and not know?
Yeah.
Actually, it can trick you during the early stages, but breast cancer always shows itself.
Okay.
It has
At the end of the
signs.
day.
At the end of the day,
Okay.
it shows itself.
Absolutely.
Oh,
Absolutely.
he must let you know, I'm here.
Okay.
I'm here.
So you have symptoms
Unlike
like you mentioned.
prostate cancer that can be there smoldering under the surface and
Okay.
it doesn't give you any sign.
Mm.
Yes, but breast cancer shows itself. It
Okay.
does.
But like Dr. Dolly said yesterday, I think you've mentioned it today as well, that regular screenings.
Especially if you're a woman. That doesn't negate cancer, breast cancer cases in males, like I said yesterday. Theirs are very aggressive. These are very aggressive.
Okay. Now this topic is becoming interesting, very interesting, because most of the questions I'm taking are questions that we couldn't actually deal with yesterday.
Okay.
Okay. Now the other thing is, now you mentioned some of the symptoms, right?
Mm-hmm.
And lump in the breast was one of them.
Yeah.
So the question now is signs, warning signs, probably.
Oh.
Could we probably say we should look out for?
Oh. Like I said before, it has first signs you should look out for. Number one is the lump. Secondly, pain in the breast. Whether there's presence of lump or not, and you have pain in the breast, it is a warning sign. Another one is skin changes on the breast mass itself. That's always a pointer. And like I said before, the dimpling, the kind of dimple you have in your cheek, if you have it anywhere in your breasts, look out for it. Another one is irritation on the skin. You're not seeing anything, but you're feeling the irritation on your skin. Is an indication that something is going on. Then you look at the nipple. Some nipples are inverted. Some nipples are even drawn in. We call that retraction. Those are not normal. Or when you stop this, you're not breastfeeding any baby and you're discharging fluid, some black fluid, some green, some even blood. You can't see those kind of signs and tell me it's normal. It's not
Okay.
normal for
Okay, Dr.
anybody.
Dolly, thank you so much. Now, I'm not a doctor, but I'm
Yeah.
learning a lot
Okay.
here from you.
Okay.
And the last thing I'll say before I let you move on to that is, this show is all about giving information, and Dr. Dolly is doing justice to that. I really want to thank you, Dr. Dolly, because I'm learning a lot, I must say.
Oh,
Now,
wow.
we have the stages, I mean,
Breast
of
cancer.
breast cancer. I
That's
know we
right.
have stages.
Yes, we
Yeah.
do.
So, what stages are there? Because
So,
someone probably watching right now is asking, so at what stage should I be very concerned? Is stage one as, I mean, deadly as stage three, or I don't know what stages there are.
wow, they have stages, like you said. But I didn't want to get into the staging because it's kind of complicated, even for medical professionals as well. First off, you have stage one. Inside the stage one, you have stage 1A, stage 1B, stage 1C, and all of that. The staging basically is for diagnosis, yes, and then knowing the category of treatment you should receive. And then we have stage two. Now, stage one basically deals with when you have the breast lump, whether it's painful or not. You go check it out, you do a biopsy, and you check it out, and it's cancerous. At that point, with just the lump, just circumscribed and contained in that mass, it is stage one. Any spread, stage two. Any spread beneath the breast mass and the breast, it has passed now the skin, the connective tissues, you're going down to the fatty areas and on the breast skin itself is stage three. Now, when it has left the skin or the breast mat itself and gone down to the breastbone, now we call it stage four, and at this stage we call it metastasis. Is metastasizing. That's it is moving now along. Usually, it moves along the lymph pathways, lymphatic nodes, and from there, from the lymphatic nodes, it can actually connect to the next breast. Yes, and then it goes back to the vertebrae bone. It's present. Everything around the axial skeleton is actually implicated. When it's spread, it's spread. So now the aim, first off, is to catch it before it metastasizes. It spreads. So now for the staging and all, is basically for the pathologist and the caregivers who actually want to stage you to know which category of treatment you fall into.
Wow.
Yeah.
Wow, fantastic. Dr. Dolly, thank you very much. And viewers, I want to say thank you so much for joining us tonight, because we're streaming live from Victoria Island in Nigeria. Thank you so much. It's evening here. And wherever you're watching from, I want to say thank you. Please share this information with people. You can click, if you're watching on YouTube, on the subscribe button, and also click on the notification bell so you can have wonderful information from Dr. Dolly whenever she's live. Now, we're going to move over now to Dr. Dolly, as she's going to give us the prevention, or the preventive measures for us to take when covering breast cancer. Dr. Dolly, over to you
Okay.
now.
Thank you, Marvel. Thank you so much. I am so enjoying this talk because it's so lively. The kind of questions you give me, they keep me on my toes.
Wow, fantastic.
Oh yeah. So now let's go to prevention directly. How do we prevent breast cancer as women, even as men, even as relatives of people who have this breast cancer? Because as I know, the relatives also suffer as much as the patients themselves. So first off, like I said, one of the risk factors is you being obese or the causes of breast cancer. So keep your weight in check. Check it. Don't lose your weight and find it yet again in the fridge. Stop. You need to keep your BMI in the ideal range. Ideal range for BMI is 18 to 25. Keep it in that range, and I don't think you have any business to do, not just with breast cancer, but also other complications of obesity. Now, secondly, you be physically active. Be physically active. Life is not a vacation. Life is not meant to be spent on the couch or on the bed. Be up and about. You have two legs for a reason. Be physically active. The third one is eat your fruits and vegetables. Fruits and vegetables. Eat fruits and vegetables. That's there's the reason why I'm trying to underscore that. Pears, peaches, and there are three of them: pears, peaches, PP what? Let me check. Pears, peaches, and actually apples. There's a reason why they say one apple a day keeps the doctor away. Yes. So incorporate them into your diet. It's actually, it was a study. 75,000 women can actually be a lie. So please avail yourself of the information. Now, another thing is avoid too much alcohol. Avoid too much. Alcohol is actually good for the health if you do it sparingly, moderately. Moderation is a watchword in alcohol consumption. Don't do it too much. Another one is do not smoke. It's not in moderation now. Do not smoke. It just doesn't do damages to your lungs, but it's also one of the predisposing factors for breast cancer. And now, this very one, I'm going to have a backlash from the slay queen mamas, but I have to say it because it is true. When you give birth, please let the breast do its job. Breastfeed your babies because it has been found out that when you don't breastfeed your babies and there's breast milk in the breast and it doesn't go out, it will be there and gorges the breasts. Over time, it starts relieving and starts, the body will do away with it. But when it stays on the breast and dries out, that's laying foundation for cancerous growth. Yes. So if it is possible, if you don't have any underlying conditions, please do breastfeed the babies. It's actually very good for mother and child, health wise. And not to talk about the bonding time also. Another one is avoid birth control pills. Yes, birth control pills controls hormones. And this gene, BRCA1 and 2, they they are controlled by this, they have receptors for these hormones. So when you take exogenous supply of these hormones in the in birth control pills, it also stimulates its growth. They said you should avoid birth control pills, especially after the age of 35 years, or if you are a smoker, should avoid it. Last but not the least, today is avoid postmenopausal hormonal medications. And if you must have it, please do regular breast screenings to rule out breast cancer. So that is all we got for prevention for
Wow,
today.
wow, 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 wow. Amazing. Now, I mean, in your earlier submissions, Dr. Dolly,
Yeah.
you mentioned rightly how substances like lead, yeah,
Yeah.
and also you spoke about radioactive waves or
Yeah.
something close to that.
Radiation.
Radiation,
Yeah.
right? Now, I also understand that today, certain cookware that people use
Mhm.
could actually sometimes contain those substances
That's right.
in quite an amount that probably could be harmful to the body.
Yes.
Yeah. So what you're saying in essence is we should eat right and also cook right.
Cook right.
Yeah.
And the way you cook right is making sure the cooking utensils you use aren't discharging a little amount into your food and thereby getting into your body and accumulating the liver.
Wow.
Most of the time, the liver does a good job to detoxify the body, but when it's too much, the insult to the liver is too much, it becomes overwhelming, and even the liver gets tired at some point.
Wow. So, guys, I mean, thank you so much again, viewers, for staying tuned. The information that we're getting tonight is really, really going to be helpful for us. So if you do have a Salad Master healthy system, please use it the right way. And if you haven't seen a Salad Master presentation and you want to know about Salad Master, please leave a comment and someone would reach out to you and organize a free health presentation for you. Now, right now, what we're going to do is go on a short break. And when we come back, our amiable Dr. Dolly is going to be sharing with us some more on cancers, and we'll go to infertility. So stay tuned. We will be right back. Okay, so thank you very much, viewers, for staying tuned. And we really do appreciate that you're watching us right now and you're learning a lot from the show. I still have in the studio one and only Dr. Dolly. Hi, Dr. Dolly.
Hello.
Now, today we've been sharing lots of wonderful health information with the viewers. And I know you still just want you to delve into that. Then I'll bring all the questions, but we have lots of questions on that. So over to you, Dr. Dolly.
Okay. Welcome once again. Welcome back from the break. And now we're going straight to infertility. Infertility is an African problem, mainly because we put so much premium on childbearing, but it is also a worldwide problem. But we Africans, we love children a whole lot. And so it's a very catchy topic for us. So what is infertility? Infertility actually is when a man and woman have stayed for 1 year under the same roof, regularly having intercourse, but has not yet achieved pregnancy under a period of 1 year. Anything less than that, I think, is too much in a hurry. Yeah, because there are so many things that can come into play for before pregnancy can be achieved. And infertility is divided into like three parts. We have the male causes of infertility, we have the female causes of infertility, and we have like 40% idiopathic. We don't know what causes that. The male is all right, the female is all right, but they are not yet achieving pregnancy. We have a lot of research has been done, and it has been found that although nothing can be found to be biologically wrong with both couple, but they might be lacking just trace amounts of micronutrients in their diets. It has been proven to be effective. So some women just achieve pregnancy by placing them on alternative diets than the one they know. So like we always, when we do, I've been privileged to see some Salad Master cooking shows, and I've seen them. The one they do the carrot tests. The way, if you don't process your carrot very well, the way you will lose all the vitamins and just be eating chow.
I've seen that one as well.
Exactly.
Very captivating.
It's amazing. So now, the way you prepare your food, you think, oh, I eat well, but actually, you are not eating. You're not getting the nutrition that your food is supposed to supply to your body. thereby lacking on the things that you ought to have. So childbearing is a very delicate topic. Children are very delicate, embryos are very sensitive. So before they make an appearance, everything has to be on point. So generally now, let's look at some foods that we have researched on and seen that many or if not most women lack it and they don't know about it. So plant proteins are very good. So if you happen to be a couple who is yet to achieve pregnancy and you are registered on this 30-day health restore challenge, which is basically plant proteins and plant originated foods only, is a very good start for you. So plant proteins like nuts, nuts are actually proteinous, yes. Beans, seeds, tofu, lentils, they are what we call reproductive power foods. That's what it's called. Another one also you can now go for if you're not a vegetarian kind of person or vegan kind of person, you can do salmon, figs, oyster, berries, leafy greens, and maca roots. Maca roots is a herb. It's a herb, but you can find it in local stores. You can find it in all these departmental stores if you look for it. So that is it for infertile couples. That's how we want to help. And most definitely, you can't say you are yet to start a family and you don't care about what goes inside your body and how you used to prepare it. You can be making your food with a lead pot, aluminum pots. Every time you cook with it, scraps of it enter the food and you eat it. And they are not digest, they are elements, they're not organic. So it piles up somewhere, causing problems. It finds its way to your ovaries, your fallopian tubes, your wombs, even on the endometrium where the baby is supposed to be embedded after implantation. All of that disrupts the reproductive system, especially in the females, especially in the females. So care should be taken on what you eat, how it's prepared, where it's prepared, and how you eat it.
Wow, fantastic. Now, just powerful information you're sharing with us, Dr. Dolly. I want to say thank you. And again, say thank you to Salad Master for sponsoring this show. Because Salad Master is, by the way, 75 years this year.
Oh my
Yeah.
God.
So they're celebrating the 75th year anniversary. What pedigree? What pedigree?
What a great milestone.
Absolutely.
Yeah.
Now, when someone's got malaria, for instance,
Yeah.
you can go and do it. You can go and check
Yeah.
if you've got malaria.
That's right.
So when someone's got cancer, like you said, you can go and check.
Yeah.
So how can someone check fertility? What do you do? How do you check if you're fertile or not? Can you do a check or something?
Yes, you can, of course. Well, when you want to achieve pregnancy, there's a whole lot of fertility checks. We collectively give it the blanket name comprehensive fertility check. It's comprehensive. You're not leaving anything. The male is checked. You produce your semen and your sperm parameters are checked. There are a whole lot of things we check for in that aspect. And the female also is checked. We start checking, start scanning your overall health of the lady. Are you a diabetic? Are you hypertensive? Are you a sickler? All of that. Are you asthmatic? All of that plays a role. When that is done, we go over to your reproductive system. We start checking hormonal profile. Hormones are actually, the production of all hormones actually starts in the brain, your hypothalamus. We start checking all the hormones produced by the hypothalamus. Is it over? And it is such an intricate meshwork that it has limits. The hormones are there, but when they are too much, it's a problem. When they are too low, so it has to strike that balance, or pregnancy will be very difficult to attain. Now, when you check all of that, your hormonal profile, you come to the ovaries, the organs. Are they healthy? Do you have ovarian cancer? Do you have ovarian cysts? Do you have, there are a whole lot of things that can go wrong in the ovaries. And then the ovaries also, are you ovulating? Because the ovary is a storehouse that stores the egg for the woman. Some women menstruate every month without ovulating, which without dropping an ovary. So now, when the sperm swims and gets to the fallopian tube, there's no egg to fertilize, so you can't achieve pregnancy. So such cases also, we call them um, hyperstimulatory ovarian syndrome. It's common actually.
Hyperstimulatory
Ovarian,
syndrome.
yes.
I'm becoming a doctor. Yeah, maybe the next time I'll come with a stethoscope. Maybe.
Yes.
Okay.
Or what you call it, polycystic ovarian syndrome as well.
Polycystic.
Yes, there are so many cysts in the ovaries waiting to be released, but they are there trapped because somehow the ovarian wall is like too thick for them to penetrate, so they just stay there. So now every month the woman feels the pain of ovulation and everything, but she is not really dropping ovaries or eggs for fertilization. So those ones are there and we can always find that out. Then we come to the fallopian tube. Fallopian tube, we have infections of every kind. The sexually transmitted infections, that's where they target. And when they go there, they block it. Now, the fallopian tube is a conduit or a channel that connects the ovary and the womb. If you're releasing ovary and it drops from the ovaries and it doesn't pass the fallopian tube to get into the womb, fertilization would still occur. And the sperm is also prevented from traveling from the vagina to the womb through the fallopian tube to meet the egg. So fertilization doesn't occur. Then we move from the fallopian tube to the uterus itself. There's so many things that can go wrong, both the one that you inherited and the ones that maybe you caused. Maybe in the course of terminating an unwanted pregnancy, a whole lot of things can go wrong. Yes, especially if you go to the quacks, a whole lot of things can go wrong. So all of that. Then downright to the cervix. Cervix, some of the women also in wanting to also remove unwanted pregnancies or stuff, they put a whole lot of things, especially quacks. And I have seen a woman who, this one now is for her to cure fibroid. Actually, oh God, a very educated person, but in her haste to cure her fibroid, according to what she was told, she introduced a chemical into the fibroid that actually melted the cervix and gummed it together. So for such a woman, before you can even achieve pregnancy, you have to take her to a theater and open up mechanically. So those are the things. So
wow.
So fertility is a comprehensive check.
Wow.
Every doctor, we have doctors, O&D doctors, which means obstetric and gynecologists. That's their
fantastic,
yes.
fantastic. Dr. Dolly, a great job you've done this evening. Just final words. I think this question just came in. Yeah, someone is asked. I believe they just sent the question to me. Someone is asking about which is more delicate, primary or secondary infertility. What does it even mean?
Primary.
And the last question, so that you take it together.
Okay.
Is there any cure for infertility?
Definitely, most definitely.
Okay. So maybe you take the first question first.
Okay.
And come to the second one.
Okay, fine.
Thank you for sending your questions in. Please keep them coming. And Dr. Dolly, even after the show, will respond to your questions in the private chat.
So infertility is broadly classified into two: primary infertility and secondary infertility. Primary infertility simply means a woman who has never achieved pregnancy at any point in her life. She's never been pregnant and she wants to be. She's classified as a primary infertile woman or subfertile woman. Infertility is like so harsh. She's subfertile, not that she's infertile. No, because at some point that same woman can still conceive. Now, secondary infertility just talks about a woman who has delivered before, whether the pregnancy was successful or not, but she has been pregnant at some point in her life, whether she terminated it, gave birth, whatever. She's been pregnant before, and maybe 5 years or 10 years down the line, she can't achieve pregnancy anymore. So she's classified as secondary infertile.
Okay.
Or subfertile.
Wow. Yeah, I know I know you're learning a lot. Now the last question says, is there a cure for infertility?
Oh yes.
Can someone have hope? Watching right now and saying, is there hope?
Oh yes. Oh, the most the beautiful thing about infertility is that in the field of medicine, in infertility area, that's where medicine has most advances, and it keeps improving by the day. There are a whole lot of things you can do. First off, you can do it. The cause of infertility depends on the treatment it receives. If you have fibroid, it's preventing you from getting pregnant. You remove it, do myomectomy, fibroid is gone. If you have infection, treat it, it's gone. If you have blocked fallopian tube, you do
What
IVF.
about email?
Email, email, yes. If you have low sperm count, you have medications that can actually grow your sperm again. But the one in males that nobody has ever found a cure for is azoospermia. What you mean? You don't produce any sperm at all.
Do we have people like that?
What? There are many of them.
Wow. Now
Some
someone
born
is
with
just
it.
learning.
Yes, some born with it, some acquired by lifestyle. Yes. So it happens. Those are the only ones. And even at that, the person, if you really want to be a father, we have sperm banks. You can buy a sperm.
Oh, wow.
There's nothing money can buy these
Okay,
days.
wow. We have had several information on this show today. I'm telling you, I have learned a lot personally, and I believe you have also learned a lot from the show. Now, it's been yet another special edition and a wonderful time of health and nutrition information. And I've had with me Dr. Dolly Nwokeji,
That's right.
our in-house salad master doctor, who has actually helped in talking about ovarian cancer, prostate cancer, breast cancer, and infertility. And these topics have been dealt with yesterday, and we've done the final session today. Just in case you missed yesterday's show, you can also rewatch it or play it again on our YouTube channel and also on our Facebook channel. Thank you very much for joining the show. Dr. Dolly, your last words tonight.
My last word is keep for I just want to address those people on this 30-day health restore challenge. Please keep on doing it, keep at it. It's not easy to go without meat for 30 days, is not easy, but keep doing it. You're going to see the results, especially for those of you who want to achieve pregnancy, who want to start your family in 2021. This is a very wonderful start for you.
Fantastic. And I want to end on this note, a quote by Dr. Otto Warburg. Now, he's a Nobel Prize winner for cancer discovery in the year 1931. Just because we talked about cancer today,
Yeah.
he said, no disease, including cancer, can exist in an alkaline environment. And I know Salad Master does alkaline cooking a lot.
That's right.
So again, thank you very much for joining, everyone. We've had a wonderful time. Thank you, Salad Master. Thank you, Salad Master, for sponsoring the show. And your $1 Billion Body Show will return to your screens next week, same time, same channel, next week. Stay tuned, and we are going to have a wonderful time on the next show. From me and Dr. Dolly, 8. Have a fantastic rest of the evening. Bye-bye.
Bye.
More than 12 million people in the UK are at increased risk of developing type 2 diabetes. But it's estimated that more than half of all cases could be prevented or delayed. Salad Master has a 70-year history in cookware innovation and is working in partnership with Diabetes UK to raise awareness of type 2 diabetes. Mariana Hotter reports on Salad Master's mission to inspire people to eat better, live better, and achieve the life they desire.
Lunch is being prepared at the Salad Master kitchen. On the menu, fresh veg and stove-top soda bread. It's a simple but effective demonstration of just how easy good food can be.
It started with our food processor, which is why we were called Salad Master. It was the master of salads, but then we grew that into a specialist cookware range. And, our mission is to inspire people to eat better, and live the life they desire.
What's the principle, Io, behind the Salad Master system?
Well, the principle is that we cook at 86 degrees centigrade, 187 Fahrenheit, and we cook in an airtight container with a medium to low heat. And what that does, it maximizes the nutrition in the food.
So no oil, no fats, no water or stock?
No. So you don't need to, because the food has got its own natural juices, if you think about it. So what we're doing is we're using the natural juices in the food to cook the food.
Diabetes is potentially the most devastating health crisis of our time. There are more than 4 million people in the UK living with type 2 diabetes and a further 12 million people at increased risk of developing the condition. The charity Diabetes UK also estimates that more than half of all cases of type 2 diabetes could be prevented or delayed. Raising awareness is crucial.